Welcome to this short video. This is about the activity that we are going to do in the class tomorrow. I have marked that activity there. It's about 45 minutes activity. In that activity, you will provide your critical comments about a given research paper. So I will brief you here what resources you will need to use for doing that. Basically, flipped classroom means we will be doing all the reading work, listening work at home, and when we come to workshop, we'll be doing the activity. So this exercise is called as critical evaluation of a journal article. This is an important exercise. So at the end of this video presentation and interactive session tomorrow, you will appreciate the importance of critical appraisal of research, which can be an article that we will be evaluating in this workshop, but in your own post-graduation, it may be manuscript, dissertation, study presented by somebody at a conference as a paper or a poster. So this exercise will help you in doing critical appraisal of any piece of research. So we will do that with the help of a sample article. So I already mentioned earlier in the workshop, we conduct research. That's one of our roles. We convey and communicate our research. But finally, we are the end user of research. We are also the care providers who wants to use the current best evidence to inform our practice. Critical appraisal skills will help you in fulfilling that role, the last role of a good end user of research. Why you need to critically look at articles? Usually when we read a textbook, we don't think there are any mistakes or any problems with the books. We accept whatever is written in the books for the face value. But that does not happen with the articles. A lot of times, a research that gets published needs to be evaluated first, because it is true that a large number of papers are never cited by others. Meaning, an average paper is cited only less than one time a year. What am I meaning to say? Once an article gets published, subsequently, after its publication, how many people refer to that article in subsequent articles? Let us say in 2010 an article is published. In 2011, 12, 13, 14, how many people cite that article? So if they cite that article, then we may imagine that, or we may believe that, okay, that article is good. That's why further researchers have referred to that article and cited it. But as I already mentioned in the further 2 points, and I'm going to mention one more point, only about half of all scientific papers are ever referred to again. That means 50% of the papers are not even cited again by anybody else. So that means that in terms of influencing subsequent research, many papers are failures. So you don't want to be reading those papers and blindly applying those things in your practice. You want to be evaluating those papers and confirming for yourself how useful that information is. That's why we need this exercise. So there are a few more quotes about how there's a lot of skepticism about the literature that we have published. You can read for those quotes for yourself. These are all quotes from very eminent editors, which indicate that not everything that gets published in the research papers actually is valuable. So we need to be vigilant consumers of the research and practice what we call as evidence-based dentistry. Here, we want to get the best evidence from published articles and use it in our practice. Of course, it comes from research. The published research might tell you that treatment A is better than B. Yes, the research is telling that, but that does not ultimately get practiced by you, maybe because practically we may not be able to do the treatment A in our circumstance because of equipment, expertise, or the cost. Or our patients may not be able to afford the new treatment or may not be able to willing to take the risk for whatever benefit that particular treatment is giving. So when we practice in our clinics, in our hospital, we just don't go by best evidence. We also see all of these aspects and then we decide to use that evidence in our practice. Anyway, the other two you will do and you will learn in your dentistry, in your departments. The first aspect about whether the evidence that the article is telling, is it really a good evidence? Should I at least believe that treatment A is better than B? That is what we are talking about in this particular exercise. And that's only a partial fulfillment for practice of evidence-based dentistry, for which you will need clinical expertise and patient values, which you will consider in your departments. So usual structure of a paper is in IMRAD format: introduction, methods, results, and discussion. Introduction usually tells why did they do the study, the rationale of that study. Method section usually tells what was done in the study, the details, so that we can replicate them. Also so that we can check if there are any errors in those methods. Then the authors will also report the results. What did they find in their study, usually in the form of tables and text, sometimes graphs as well. And in the discussion section, usually authors try to explain the context of their study in terms of rest of the scientific literature. What does it mean? So when you will try to do this critical evaluation exercise using one sample article, this sample article has that same IMRAD format. The article chosen for this particular workshop is from Indian Journal of Dental Research. The title is Using Nitrous Oxide Inhalation Sedation for Classical Conditioning and Evaluative Study. So when you read this article, please use all the knowledge that you have gained from the workshop, including how a title should be written, how should an introduction be written, how and what aspects of methodology have been addressed here and not have been addressed here. What is good about this article and what could have improved. So try to use your critical mind to see how the article is. So please read this article before you come tomorrow. It's not a very big article. Just go through the article and you will need to answer these questions from introduction, methods, results, and discussion. I'm just going to enumerate those questions now. Of course, title also you can comment on, abstract you can comment on. Only important things. Small mistakes, just forget it. So comment on whether the rationale of the article is good, whether the need for study is really there. Are there any lacunae in previous literature that has been pointed out by the researchers, or do you feel this research is really needed? Then try to see whether the authors have presented the results with clarity, the objectives with clarity. Are the variables and hypotheses very clearly mentioned? You can see that as well. And then in the method section, you try to see whether the design is appropriate for the research question they are asking. Are there any aspects related to methods? Are the comparisons appropriate? Are the measurements or the methods of data collection appropriate? All that you can see. And then try to see whether there are any errors in the methodology. Are there any biases introduced? And see whether those errors are reduced, or you can also propose alternative methods by which the errors could have been much lesser. Also go through the results section. Just see whether the data is presented appropriately and try to have an overall judgment whether the results are new. And then you can, all of this together, we call it as internal validity. Basically, by answering all these questions, you will be able to say whether the study was conducted properly or not. And then you also will have to ask another question. Are the results relevant to my practice? So this particular aspect is also called as external validity. A study may have been very well conducted, but the results of that study may not be practically applicable to our own practice. In this case, assume that you're a pediatric dentist, because the article is from Pediatric Dentistry Journal, and comment whether the results of this particular study will be relevant to an average pediatric practice. In what way they will be relevant or in what way they are not relevant. You can comment on all those things. So all of these questions you will be answering using the chosen article. I have also circulated along with the sample article how to critically appraise an article. So this particular reference is very useful. It's a very broad article about how to critically appraise another article. And this is a good document. If you can go through a little bit, this has a few things. For example, it has some questions that you can ask. You can see in the box number 1, 10 questions to ask when critically appraising a research article. And again in box number 3, there are methodological points related to a randomized trial, for example. So you can use some of these questions as well. Of course, in discussion tomorrow, we may not be able to go through all of these aspects, but these are some of the guideposts that you can also use other than the questions which I mentioned earlier. But what I expect you to use are the questions which I already showed you earlier. So basically there is a need to develop for you some analytical skills so that you can become a good conductor, communicator and consumer of research. Please note that even published manuscripts contain errors that can influence the truth and usefulness of the article. So not all published articles are useful and you should be able to discern that